Hey everybody, we had a listener who had a question about thyroid function and how does it affect health. Well, the thyroid is involved in many functions of the body. It's involved in metabolism, growth and development, brain function, bone health, muscle function, and cardiovascular function. So all of these areas can be affected by your thyroid. When thyroid's off, it often goes up or down. We call it hyper or hypothyroidism. And the reality is that most thyroid patients are autoimmune. So what that means, autoimmunity means that the gland itself underfunctioning or overfunctioning is because the body is attacking the gland. Very different reason if the gland itself is just not working, the body attacking, causing it not to work. So that first should be determined. So how does the thyroid affect all these other functions? What kind of symptomology could you be looking out for? Metabolism. If you're hypo, then you could be gaining weight. If you're hyper, you could be very thin. You could be hungry all the time, but still can't put on weight. How is it going to affect growth and development? It could stunt growth. That could be a real issue for some people. Brain function. A very common symptom of thyroid conditions is brain fog. People complain about it all the time. Bone health. It could actually exacerbate or lead to osteopenia or osteoporosis. Very important. As we get older, when we're past our 70s, if you fall and break a hip, life expectancy is only around 9 months. It's such a trauma to the body. So the reasons for this osteopenia, osteoporosis could be, of course, thyroid, but also for more women than men because of sex hormones, not just how much calcium are you taking, okay? When it comes to muscle function, we understand as far as muscle tonacity, the ability to have strength and function and move and do things in our lives. And cardiovascular system, common symptoms that we might feel are things like palpitations. Oh, I'm getting palpitations. And sometimes people feel that because their medication is too high. Tachycardia, rapid heartbeat, bradycardia, your heartbeat being too slow. So thyroid is involved in literally almost everything in the body, and it's very important and foundational to our health. Also remember that if you're autoimmune, about 80 to 90% of patients actually are autoimmune. Most patients are underdiagnosed. Very important to determine that. If you are autoimmune, the likelihood of future autoimmunity can go up to 80%. For example, difficult diseases like MS or lupus. There's no MS patient in all of the earth that woke up one day suddenly with MS. It doesn't happen like that. There's a process started, people aren't paying attention, and it's building with time. We handle a tremendous amount of autoimmunity in our office, and about 80% of our complicated autoimmune patients like MS, Parkinson's, lupus, they all started with thyroid autoimmunity. So the first thing to determine is your thyroid healthy? How do you get the proper testing for that? We're happy to talk to you about that. Please contact our office. I hope this has been useful. Thank you very much.